We're 8 months from PPE shortages and scarce COVID-19 testing.
We buried him May 21st.
Toby Downing is 6 months from losing her dad.
His name is Toby too, but with a Y.
Toby White was 75, a Vietnam vet, a Marine, a father and grandfather. He died from COVID-19 in May.
I think he would be happy to hear that there's potential vaccine that may be available. He probably will wait to see.
State and local public health officials are not waiting to plan how they'll vaccinate people. Every state and cities, including Philadelphia, have outlined general plans to distribute a vaccine.
We have some serious concerns that it's not that these efforts are just not delving deep enough into at that community level, at that local health department level, where the rubber meets the road, where that is where people are going to get vaccinated.
Lori Freeman represents 3,000 public health departments across the country. She tells us federal health officials are failing to communicate key details about the vaccine to local health departments.
It's a continuation of a problem that we've had since the start of this pandemic, quite frankly.
Here's an example. The CDC knows the front-running Pfizer vaccine needs to be stored at nearly 100 degrees below zero. Last week, the CDC's vaccine task force had a call with state health departments and told them this.
We do not recommend that any partner purchase equipment to store this vaccine at ultra-cold temperatures.
But this week in Philadelphia, the city health department bought 2 of these ultra-cold storage medical freezers. Each can hold 160,000 doses of Pfizer's COVID vaccine.
If Mercy Hospital or any hospital in the city says, we ran out of doses, we wanted to be able to dip into our own freezers and drive them out there so we don't hold anyone up.
Dr. Carolyn Johnson heads Philadelphia's Vaccine Advisory Committee. She's in charge of planning vaccination logistics. The CDC told state health departments to manage their supply through the amount they order, not by storing doses locally.
We really are operationalizing things, and what's going on in Washington, it does not affect the kind of planning that we're doing.
Dr. Johnson said there are still holes in state and local vaccination plans because there's holes in the information that's available.
No one knows how many doses are coming. No one knows how safe and effective it's going to be yet. So, I don't think anyone is withholding information from us. There's just so many unknowns right now.
Another unknown is who's paying for all the logistics involved in vaccinating millions of people. The CDC director told Congress it would need to authorize up to $6 billion to vaccinate the nation. So far, Congress has authorized just 3% of that, $200 million.
We have received trivial amounts of money to assist with distributing the vaccine across the city.
Philadelphia's Department of Health says it will spend at least $15 million vaccinating. That doesn't include what hospital systems, clinics, or any other healthcare providers might need. In Philadelphia, health officials couldn't tell us when we might see the first vaccine being distributed to healthcare workers. There's just not enough information yet about when the vaccine might get FDA approved. But the health department did tell us that once the first doses arrive in Philly, we can expect people to be vaccinated within 24 hours. It's the latest from Philly. I'm Mitch Blacher, NBC 10 News.